Okay, if it's about 5:30 now and you're feeling tired, it could be because you have a snorer in the house that just keeps you from getting a good night's sleep every night. So we have invited ENT Dr. Robert Puchalski here, South Carolina ENT. Thank you so much for coming in to talk to us about some snoring myths and what actually works. But what is the basic cause of snoring for some loud snorers?
Well, thanks for having me, Andrea. So the cause of snoring could be either nasal or it could be palatal and oropharyngeal. So it really depends on the individual, and it could be something that's there every night or something that's just occasional.
Okay, for the people that really have this going on in their lives, you will try just about anything to get it to stop, to get your partner to stop. So we want to go through a list of some of the ideas and the products that are out there and tell us if you think they are going to stop snoring. Number one on that list, those nasal strips, which I actually used those when I was pregnant for some reason. It helped me breathe. But what do you think about the nasal strips?
Nasal strips is something to stop snoring isn't very effective.
Okay.
It'll change the acoustics of snoring, but it won't change the actual source.
Will it make you quieter of a snorer?
Yeah, it'll decrease the resonance of snoring, but not necessarily improve it at all. Most of the obstruction that you have with snoring when it's nasal is deeper in the nose and not something limited to the outside of the nose.
Okay, how about number two on the list, losing weight?
Always a good idea, always something that's helpful. Behavioral modification, whether it be stopping smoking, stopping drinking alcohol, stopping caffeine, will help you, particularly if weight gain has been recent and has been in conjunction with the snoring. Then reducing the weight will help alleviate the snoring.
Okay, number three on our list, sleeping on your side. Does that really help? I know that people can really get going more if they're on their backs, but what do you think?
Yeah, so snoring on your side will help you. Positional therapy is what we call it. So if you can go ahead and try to reduce sleeping on your back, it'll help, because when you're on your back, your tongue will fall backwards and worsen the oropharyngeal and palatal aspects of snoring, which are by far the greater. And so if you can try to sleep on your side, or maybe sew a tennis ball on the back of your pajama, or wear a little backpack, or get a full body pillow, those things will help you sleep on your side.
What? If you put a tennis ball on your back?
Absolutely. So you can buy little backpacks that you put on, but you can also just take a tennis ball, take a patch, sew it in the back of your pajama, and this will help you.
That's crazy, but it'll keep you from rolling over. Okay.
Yeah.
Next on the list, sleeping with a humidifier. Is that going to help?
So it'll help, and so if somebody has a dry mouth, if somebody has allergies, it could make it worse or it can make it better. It really depends on the individual, and I wouldn't recommend using it across the board for everybody.
All the time. Okay, and then how about staying away from your evening cocktails?
Absolutely. If you can go ahead and avoid alcohol, alcohol loosens the muscles that contribute to snoring, and so if we can stay away from that, we can help the snoring aspect. So. And
finally, all those fancy pillows that they want to sell us on late night TV, do those work?
No, I would tell you to stay away from the fancy neck pillows, and really it's difficult to go ahead and stay in a position with a neck pillow, and oftentimes they're very expensive. So I would try to pursue some of these more natural alternatives for the treatment of snoring before using this expensive avenue.
Now, I know you are a sleep expert, and at your practice you really treat people for this in all sorts of ways. So how do you know when somebody really needs to come see you for the next step? Sure.
Well, the most important thing, Andrea, is that we try to identify individuals who have benign snoring and those who have snoring as a marker for sleep apnea. We have to remember that 70% of habitual snorers, those that snore every single night, may have sleep apnea, and sleep apnea increases our chances for a lot of comorbidities: hypertension, diabetes, stroke, dysrhythmias, dementia. And so we want to be able to make sure we identify those individuals, and we do that with questions in the office. And so if you have hypertension or comorbidities, if you're sleepy during the day, consider talking to your primary care physician or provider and try to get some sort of a sense on whether or not you need to be evaluated.
And then they would come to a sleep clinic.
Yeah, a sleep study is typically, we'll ask some questions. Sometimes we use a sleepiness questionnaire called an Epworth, sometimes we use a Berlin questionnaire or something else to try to identify whether or not a patient might be more likely to have sleep apnea as opposed to snoring. And then we'll get a sleep study if it's appropriate.
And then a CPAP machine could help.
Well, absolutely. If you have sleep apnea, the most common treatment for that is CPAP.
All right. So there you go. There you have it. Dr. Robert Puchalski, thank you so much for taking the time to come talk to us today. Hope you get just a little more sleep tonight because of that. All right. Stay with us when we